Uganda today joined the rest of the world in commemorating World Hospice and Palliative Care Day. Another theme, achieving the promise, universal access to palliative care. The day highlights the importance of compassionate care for people with life-threatening illnesses, focusing on relieving pain, restoring dignity, and improving the overall quality of life for patients and their families. During the celebrations, Dr. Nixon Nyonzima from the Uganda Cancer Institute emphasized the urgent need to expand access to morphine and other essential medicines used in palliative care.
I'm delighted with the advocacy that is here. I was telling Prosi again earlier today when we were touring Hospice that we had a month earlier this year when we had no morphine at the Cancer Institute. Actually, I think it was countrywide. And every patient who had pain across the city was being sent to Cancer Institute. And we were also sending them to Prosi. And none of us had a solution for those patients. And it's a challenge. And for the DG, maybe we need to make sure that we expand access to morphine, provision of morphine across the country.
He noted that the increasing cases of non-communicable diseases in the country call for stronger and more widespread palliative care services.
To strengthen palliative care services across the country. And again, because the PS is in education, I also want to highlight the role of education or training in provision of palliative care services. We need the training in all health training facilities, but Madam PS also, we have all these schools which have palliative care clubs, the role of sensitization.
The call was echoed by Maka Mwesiga, Executive Director of Palliative Care Association of Uganda, who urged the Ministry of Education to strengthen palliative care training in nursing and medical schools.
They are universal and they touch all of us. Now, we want to request you, or we are requesting you kindly, that you speak to your schools, wherever they are. We have done excellently well. Okay, there are some issues, maybe the senior people will tell you that some of the times when the nursing schools, especially those who are teaching certificate nurses, they are not delivering quality palliative care education.
He noted that many institutions give little or no attention to the subject, leaving a gap in the service delivery.
And when they come out, there are complaints, and we have those as an association. We will come with that request on how to improve the quality of palliative care education in the nursing schools, especially at certificate level and the diploma, which is not like the specialist course.
Representing the Ministry of Health, Dr. Charles Oraro, Director General of Health Services, reaffirmed the government's commitment to promoting palliative care.
So palliative care forms part of Ugandan policy and development, and we are dedicated a division. When we did the restructuring, we created a division, and we have an assistant commissioner who also pretends over palliative care.
Said that the ministry continues to license and approve more institutions to offer these services and emphasize the importance of research and public awareness.
So as we mark this day, I call definitely for intensified advocacy, expanded research, deeper health integration, and increased public awareness as a human right. So we really need to look at that. But I also want that as we do the integration, we need to be able to see that as we do most of the services which we apply, where is palliative care? So that when we talk of universal coverage, it's universal coverage that we should not leave anybody behind.
Chief Guest Dr. Kedris Tujagenda, Permanent Secretary from the Ministry of Education, applauded the Ministry of Health and all stakeholders for their tireless efforts in extending palliative care services across the country.
That below age 18, we have about 23 million. So if these young people now can grow up knowing that we are human, we have the head, we have the heart, we have the hands, and God has given us an opportunity to be in school and to learn so that we can help each other and help others who don't have that opportunity, then definitely we shall have a different nation tomorrow.
She also commended individuals and organizations that continue to promote compassionate care for patients and families.
Quality education develops that one. And palliative care clubs and other clubs of health and other clubs in the schools contribute towards that. How do I react when a friend faints? And of course, this goes hand in hand with Red Cross skills of first aid and all these things.
The commemoration served as a reminder of the importance of integrating palliative care into all levels of health service delivery, ensuring that every Ugandan facing serious illness receives comfort, dignity and support. Julius Mhomuza, Church of Uganda Family TV, News at 8.